I'm Dr. Streicher. Your question is, if you're using a local vaginal estrogen to alleviate vaginal dryness, how long is it safe to use? I'm going to give you the inside information. First of all, estrogen does not accumulate over time. The almost non-existent blood level of estrogen in a woman who's been using a local vaginal estrogen for 2 years is the same as the woman who's been using it for 20 years. And in fact, the North American Menopause Society states vaginal estrogen therapy should be continued as long as the stressful symptoms remain. So vaginal estrogen can be used as long as someone is interested in having intercourse and in maintaining vaginal health. In other words, until death. For many women, the real challenge is finding a partner who's still good to go. Often women who are between partners are not interested in sexual activity for whatever reason, ask if they should continue their vaginal estrogen. And that depends. If you want to maintain lubrication and elasticity, just in case, so that if you decide to become sexually active, well, then obviously it's a good idea. And in addition to keeping up with your vaginal estrogen, it's also a good idea if you're between partners to stimulate vaginal tissue on a regular basis using a dildo or vibrator. There is a lot of truth to use it or lose it. Many women, though, use vaginal estrogen for non-sexual benefits, such as preventing recurrent urinary tract infections or reducing or even eliminating that urinary urgency, that gotta go feeling. Other postmenopause women experience chronic itching and irritation from vulvar dryness, and they're just far more comfortable using a local vaginal estrogen in the vagina or on the vulva. There is no downside other than the expense and the inconvenience, and that's obviously a personal decision. But from a medical point of view, in spite of what the product label says, there is no medical risk, zero. And there is no risk from using a local vaginal estrogen for decades. So for more information about local vaginal estrogen options and also non-hormonal options to treat the vaginal and vulvar changes that occur after menopause, check out my book, Sex RX, Hormones Helping Your Best Sex Ever, and also my other videos and articles, which can be found on drstreicher.com.